So we started to develop interest in looking at liquid biopsies, or being able to essentially detect mutations in patients with myeloma using a blood sample rather than bone marrow. A few years back, when I had designed a clinical trial that was a targeted trial, meaning that we were going to give a specific drug to patients that had a particular mutations in Ras or Raf. And in order to be able to select those patients for the trial and assign them into a group that either had a mutation or did not, we needed to do bone marrows, and we needed to do DNA sequencing on the tumors in the bone marrow. That's quite invasive. Patients have a lot of apprehension. It's painful for them. So we felt that, wouldn't it be great if we could be able to screen and identify these patients using a blood test rather than a much more invasive test. We had seen some publications in colon cancer where people were identifying mutations in KRAS through blood, and decided to try to use this approach for myeloma. So we worked with one of our genomics specialists at Princess Margaret, Dr. Trevor Pugh, who had developed a very small panel of 5 genes. And then, importantly, the genes that we were interested in were included in that panel. We decided to do a pilot study to look to see whether or not we could identify the mutations in blood. And it turned out to be a very successful project. We ended up collecting blood samples from 64 patients, and we had matching bone marrows in 48 of those patients, and essentially confirmed that yes, we could detect the mutations of interest with high sensitivity and specificity. And so now we've gone on to be able to really refine the panel to include more genes, selectively choosing molecular abnormalities that are important and relevant for myeloma patients. And so we've designed the panel to look at various changes, such as translocations, which may have importance for prognostication, mutations that may sort of help direct therapy in the future, may predict if patients are resistant to specific drugs, or again impact prognosis. And we're also looking at changes in the immunoglobulin chain locus that can potentially identify the tumor clone, and we can maybe use that to track the disease through the course of treatment if the patient's gone into a complete remission or if the disease is starting to come back. So we've been optimizing the platform. Certain aspects of the platform are working very well. So the expanded mutation panel has been very successful. We're identifying additional mutations in patients and showing actually that the mutations in the blood are changing over time after treatment and may reflect disease that's growing outside of the bone marrow. So now we're working on optimizing the other aspects of the study, the translocation detection and the VDJ rearrangements, so that we can, as I said, not just look at being able to detect mutations, identify patients for trials, but use this kind of blood tests for additional purposes, such as translocation detection or potentially low-level MRD detection. Again, that the goals of sparing patients' bone marrows, being able to include these types of tests for clinical trials, patient selection. And so far, our assay has now been, at least the mutation detection is being transferred to the clinical lab, and I think any day now we should be going live with being able to actually offer this as a clinical test for patients in Canada.